Good afternoon and welcome to another Northern Berkshire COVID-19 update. I'm North Adams Mayor Tom Bernard alongside Adams Town Administrator Jay Green. We're going to take just a few minutes to kind of update you on where everything stands in the Northern Berkshires right now as far as our response to COVID-19, and then we'll allow some time to open up the phone lines toward the end and answer any questions and respond to anything that might be on your mind. We did this first time about 2 weeks ago and it seemed to work well and be well received, so we wanted to just give you another chance to hear from us how things are going in the Northern Berkshires right now. And what I'll do to start is say that as of today, and the most current data, there are 40 confirmed cases of COVID-19 in the city of North Adams. 24 of those cases are folks who have recovered or been released from isolation. There are still 15 people in stages of isolation and quarantine, and we have lost one member of our community to this virus so far. But those numbers also don't speak to the full impact, because we also know that there are residents of North Adams who were residing in the Williamstown Commons nursing home, and some of the numbers in Williamstown are our friends, our neighbors, our colleagues, and our family members here in North Adams, and we need to keep that in mind as well as we deal with what the governor today called an insidious and at times invisible virus for which there is no cure or no vaccine at this point. Jay, do you want to give an overview of where things are in Adams right now?
Sure, I can. Grand total so far of COVID-19 cases in the town of Adams is approximately 23 cases total. Presently, right now, we have only 9 open cases. And I think it's important as we continue to talk about statistics for the balance of the show that our folks at home remember that you should not use these numbers to predict trends or any statistical takeaway from it that would allow us to determine when can we relax some of these restrictions. I think there's a lot of conversation that we're having lately about that. When can we relax these restrictions? And a lot of folks are going to be paying a little bit more attention to the data and the empirical data, and we don't want to set that case. So right now in Adams, we have 9 open cases. We have not had any positive additions to that list in about the last 48, 72 hours.
That's great. The number today for North Adams increased by an additional 2, so that 40 is plus 2 from yesterday. So as we start, I think the most critical message is the one that the governor and everyone on down has been stressing on a daily basis. Stay at home unless you absolutely need to go out. As far as late-breaking new information for today, the governor and Lieutenant Governor announced today that schools, all schools, public and private in Massachusetts, will be closed through the end of the school year. However, the expectation from the state down to the local level is our remote learning plans and our remote learning operations will continue through the scheduled end of the school year. And as we have done since we declared the state of emergency in North Adams on March 13th before the state put their order in place, we will continue our daily meal service for students. This wasn't an easy decision, I know, for the state, but I think I know it was the right one and the appropriate course of action for our students, our professional educators and our staff, our families and caregivers and the community. It provides clarity, it gives a definitive answer, and it will help to keep people safe. It's also going to make some things real hard for students, particularly our seniors who are coming to the end of their time at their school and looking forward to what those celebrations look like. I don't have an answer for that yet, and it's something that we'll definitely talk about in the schools, in the school district. The district leadership teams, the principals and teachers, and the students will have a chance to weigh in, because we want to make sure that what we do feels appropriate, feels respectful, feels inclusive, and feels celebratory, even if we can't provide a situation where students gather the way they were expecting at the start of the school year. But as Jay indicated right at the beginning, we are in what is known as the surge. We're in that period where cases continue to increase. The State House News Service, the media, the governor, everyone on down is saying, by all statistical measures, we have become a coronavirus hotspot and we're in the surge. So as we said, what we want to do is look at a little bit of the data, and fortunately, the Mass Department of Public Health, starting yesterday, started providing all of us with a new look at the data. So we'll throw some of that up on screen and talk about what some of that means. So Jay, do you want to do the big
Sure.
news for today?
The first slide that we have is the overview. And if you look at your bottom left, you can see that the total tests performed in the Commonwealth is now at 175,372. Of that number, 41,199 have been confirmed. Newly reported cases today of just about a little over 1,500, so you can see where we're still surging here. The percent of all the cases currently hospitalized is thankfully only at about 9%. However, the deaths of confirmed COVID-19 patients is at 1961, and the newly reported deaths today at 152. So you can still see when you take those numbers one by one, that's still a substantial impact on our population and on individual families here in the Commonwealth.
Yeah. So when we talk about flattening the curve and what that looks like, we want to show you from the state data perspective what the curve looks like, and that's that line going that blue line going up, the cumulative increase in cases. And as you can see, that looks like a line that has not yet flattened off. So we're gonna continue to see increase based on all the models for a while now, with variations day to day as those cases continue to go up. And we see a similar curve again on the case of those who have passed from COVID-19 statewide. Jay, do you want to take a walk through some of the Berkshire County data?
Sure. So on the deaths rate by county, you'll see on the left-hand side of your screen count of deaths and confirmed COVID-19 cases by county that Berkshire is at 29. However, you also see on the right side of your screen circled on that bar chart that the rate per 100,000 of deaths and confirmed COVID-19 deaths by county is at 23. I think it's important to remind people at this point, particularly if we move on to the next slide and we look at the total of Berkshire County cases, that being at about 404 for today. This number changes each and every day. And at the same time, perhaps this number looks low to folks at home, considering the total population of the county, which is 150,000, 160,000.
130, a little lower than that, yeah.
Because our social distancing and all of the measures that we've put into place coming as directives from the state agencies and federal government are working.
Right.
That's the takeaway. This doesn't mean it's the time to let up or let our guard down. As the governor said today, we have to win this game. It's the third quarter, it's the fourth quarter. We're in the middle of a surge. Now's not the time to give up, and we have to stay the course.
Sure. And I think we stay on this chart for a second, the Berkshire County data, because yesterday, as they rolled out new data, there were no new reported cases. Today, there were 17 new cases. So you see near the top of that curve, it started to look like it was maybe leveling off a little bit, but now we've got that short line of yesterday to today, which is shooting up. So day-to-day variation isn't what we're looking at. We're looking at the trend over time, and it's still increasing both in Massachusetts and here in the Berkshires. So with all of that, let's talk about where we are and what's next, and just at a really simple or a really basic overview level first. And so as of today, the governor's essential services and gatherings orders are still in effect, and those run through May 4th. So we can imagine really two sets of conditions based on how we respond if we see that curve, or the governor of the state sees the curve flattening, local effects. So there's one model which would be the relax and phase in and start to reopen. And then there's the version where we extend and strengthen because we really believe that what we have to do is continue to do what's worked so far. So the relax model is we start to see selected businesses reopening gradually, and those orders amended or relaxed. And then the other option is the business closures continue past the May 4th date, and that stay-at-home advisory gets strengthened into an order or into enhanced recommendations. Given what happened on the school side today, my assumption and my expectation is we're going to see more in the way of strengthening, and I hope that's the direction we go in. But really, day to day, we're watching the news change, and that's what we want to be paying attention to.
The other point to make while we're on this slide too, Mayor, is folks at home may be wondering about other states. How come other states can begin to open up or relax? And that is because they may have had far more strict regulations up front. For Maine is a prime example. They had a very strict stay-at-home order. Other states haven't had the influx of positive cases that Massachusetts had. Each state, each community, each county has to take it on their own. They have to look at their own data, and using empirical data from their own health professionals, they have to decide in their own interest how to do this. Yeah. If we take a misstep, it could set us back upwards of another 30 to 60 days. And I don't know about anybody else, but I would like to get out of this as soon as possible.
Absolutely. And I think that this is one of the things, and we talked about this the last time, and we've been really clear as we've had these conversations and as we've worked through this since the beginning. We're doing this as a Northern Berkshire update, and we're working collaboratively across the Northern Berkshires. As much as possible, we're sharing information, we're sharing recommendations, we're trying to stay aligned in our decision-making, in our response, in our messaging, so that we're not going community by community. We're making decisions regionally to the best effect. You know, our health, our public health folks are working together. Our operations center reflects the 8 communities of the Northern Berkshires, and that's really been a strength of our response, and one of the things that has helped to keep these cases relatively low. But if there's a key message in all of this, it's quite simply, now is not the time to let up. We're quoting the governor a lot. I think we may as well continue to do it. Governor, on Sunday, I believe that in Massachusetts, for us to get back on our feet and start thinking about reopening, we've got to have better knowledge and better understanding and support for people that are dealing with the virus and those they come in close contact with. That's that social and physical distancing message that we're talking about, that keeping each other safe, protecting other people, wearing face coverings, staying at home whenever possible to prevent contact happening. I was on a meeting or on a call the other day, a Zoom meeting, with somebody from Harvard Medical School, and they really laid out 3 sort of things that we need to see in order to start relaxing social distancing. One is to decrease the number of cases in the population for which we need more testing. We need a reliable surveillance system to detect new outbreaks. That means, this contact tracing you've heard about that's following people's comings and goings so that we find the circles they move in if there is infection, so we can track that. And then an action plan for what we do if and when we start to see new outbreaks. Again, the goal of all of this isn't just to keep each other safe, it's to keep our healthcare system safe and not to overwhelm that. Message today was, if we do this wrong, we will create more hardship for everyone in the long run. Jay, you said it, this 30 to 60 day extension is what we could be facing. Mm-hmm. So, and let's really look now at what some of the real risks are if we relax physical distancing too quickly. And do you want to walk through some of those?
Yeah, the risks of relaxing physical distancing too quickly is really drastic. This is a very difficult public health crisis to manage because the enemy is invisible. But we want to remind everybody, there's a risk of a second wave of COVID-19 cases. If we're not successful in flattening the curve, that's going to overwhelm the healthcare system capacity. We see those overflow hospitals, field houses constructed in Worcester and in the eastern part of the state. Right now, there's very few people in them. We'd like to keep it that
yes.
way. We'd also like to keep some capacity in the healthcare system for those folks suffering from ailments not related to COVID-19. And it's going to be a far slower and more difficult economic recovery for us if we let up and we don't press on. The bottom line, and it's drastic, but it's the truth, more people will get sick, more people will die, more people will struggle and suffer if we don't stick to our guns now at this time of crisis.
Yeah. So let's talk about some of the best practices. I've put this out in my daily updates. You've seen some of these, and these are just the messages coming right from the state. These are their slides, their images, right? The first piece of advice: stay home, stay safe, save lives. If you don't have to go out, if you don't need to go to the market or the pharmacy or to deal with your health care needs, stay home. It is to protect you. It is to protect each other. It is to protect our first responders. It's to protect our entire community and our health care system. It's to protect our economy. It's to protect our students and our young people. The next one, and I've got a few visuals with this, cover your face. The advisory from the CDC, the Centers for Disease Control, from the Mass Department of Public Health, cover your face, wear a mask if you're out in public, particularly in those places like the market or the pharmacy where social distancing or physical distancing is difficult. So if you can't find one of these, or if you don't have somebody who's made you, a cloth mask, if you can't get access to one of these, find whatever you can, a bandana, a t-shirt, a scarf, something to protect your mouth and your nose. And I just covered my face, which you're not supposed to do, but you get the point of the message is cover your face where you can. Jay, do you want to take the next
Sure.
one?
Best practices. At the end of the day, the measures to prevent the spread of COVID-19 really are basic. They're the same as any other flu. So as dire as it sounds with COVID-19, particularly because of its ability to spread so rapidly, at the end of the day, wash your hands often, avoid touching your eyes, nose, and mouth, sanitize, clean things that are frequently touched, like doorknobs, etc., cover your mouth when you cough or sneeze, stay home if you're sick, and avoid close contact with others. And think ahead about how to take care of yourself and your loved ones if your virus starts spreading in that community or at home. That's important to have an action plan. It's also important to remember, too, that yes, we have a stay-at-home order. Right now it's advisory.
Yes.
If everyone's able to voluntarily comply with that and not go out without having a required reason to do so, it probably won't become mandatory. But we've seen some behavior over the last 2 weeks, particularly since the weather is getting better, of a lot of folks going out and about. You can still leave your home. You can still go out, shop, take advantage of the outdoors. Just be reasonable about it. Find the balance. I think that's the takeaway message. Find the balance. And when in doubt, stay home.
Yeah. But again, yes, that's the message. Stay home. But we do recognize that fresh air, a little bit of exercise, getting out and moving, these things matter. They're good for your physical health. They're good for your mental well-being. We have neighbors in our neighborhood who have always been walkers, and you see them out there. The three of them in their group keep one on each side of the road, one in the middle. They're keeping their distance. They're getting a little bit of community, but they're doing it in a safe way. And the other thing is, we know that despite all of these messages, despite all of these orders, there are people who have skill, who have talent, who have a desire to help. And if you fall into that, particularly if you have experience in healthcare, but whatever it is, if you want to volunteer, here's a place you can do it. You go to maresponds.org, and there's a link on this slide. You can go there, you can sign up, and you can offer to help, and you'll be matched with opportunities. The other really critical message, we're talking about the transmission of the coronavirus. We're talking about this this particle that travels through droplets. But I also want to talk about another viral threat that we're facing, and that's the threat of misinformation. So we really want to stress the places that you can go to get reliable, trusted information from experts, information from the public health system, information from the state. So the first of these is just a list of state resources. The mass.gov website has daily updates on their COVID-19 page.
The format's gotten far better over the last
They've been,
few weeks.
they've been improving that. As we showed some slides, the Department of Public Health has really been changing that up and going from just a daily, one-page table to charts and graphs, and really showing a much more comprehensive view so we can all understand it, especially if, like my good colleague here and myself, you're a little bit of a data nerd. So that's not a bad idea. Mass 211 is a great place to go for questions. Just dial 211 on your phone. COVID MA, send that on your mobile phone to 888-777, and you'll get updates as they happen. And then the governor gives a daily update, and you can follow those on YouTube. We know a lot of people are struggling with the economic effects, and there's a lot of good information, particularly about the unemployment assistance for independent or gig workers, but just in general, if you go to mass.gov/DUA, that's for the Department of Unemployment Assistance, great set of resources there, including information on how to apply online for unemployment support. The other thing we know right now is a lot of people are feeling particularly vulnerable right now, particularly those experiencing or who have experienced or are survivors of domestic violence or sexual assault. And the state has resources, the SafeLink program, 877-785-2020, and locally our Elizabeth Freeman Center, 866-401-2425. Critical resources. Other places, we have some good local things. Jay, do you want to talk about the Operations Center?
Sure. The Operations Center is quiet, but it's still coordinating our mutual response here in the region. And if you wish to volunteer, or if you wish to understand what's going on in the community in terms of resources, or if you need something, you can call them at 662-3614. We have some very dedicated volunteers who are spending their time in the Community Liaison Office. They're ready to help you out. And we have some great organizations backing them up in terms of being able to get the resources to the people who are in need the most during this time frame.
As I mentioned, I do a daily update. You can sign up for that on the mayor's office page on the city website, www.northadams-ma.gov, and it'll come right to your email, your inbox. I also post it to social media. You can find me online at Facebook and Twitter at Mayor Bernard NA. I think this one's been around public access and flyers and other places, but here's a great list that Councillor Harpin put together of resources across the community. Some of the ones that we mentioned, but some others, the Department of Children and Families, food service programs, the places you can go to get a meal. And then we also had a note waiting for us when we came in that NAMI of Berkshire County has a warm line at 413-445-1136, and that's for anyone who's feeling stress, isolation, fear, just somebody to talk to get some coping strategies to get through this. They're available daily till 8 a.m. And it's all, again, it's part of this community liaison, this community outreach function that was part of the reason that today we had what we were calling Northern Berkshire Cares Day. And I want to thank everybody who went online onto social media, shared the hashtag NorthBerkCares, or just in their own quiet way did something to reach out, to share their strength, their information, their support with somebody in their community, whether it's a family member, a first responder, anyone. With that, I think we should open up the phone lines before we jump to some closing thoughts. I don't know if anybody has a call, a question, something we can answer in the next couple minutes.
While we're waiting for that, Mayor, I'll go through a few things with Adams just
Sure.
in case folks are wondering. Last week, the Board of Selectmen in the town of Adams voted to adopt Section 11 of the Acts of, Chapter 53 of the Acts of 2020. That essentially extends the waiver of fees and penalties for taxes all the way through the end of June. So we encourage any folks who may not be able to make that May 1st tax payment in the town of Adams, please call the treasurer's office. There's staff there, 9 a.m. to 1 p.m. Give them a call, and they'll work with you through it. We have some great meal distribution programs going on Saturday mornings, and the Hoosick Valley School District is still doing a meals program as well.
Great, thanks. We also did the extension of the tax deadline in North Adams, so that's something that's happening in both North Berkshire communities. We have a call right now, so I'm going to open up the line. Hello.
Hello. How does one go about getting tested for COVID-19?
Well, there's a sort of a set of criteria that the healthcare providers will follow. One of the great ones, and we should have put it in here. The best place to start is Buoy Health. BUOY Health has an online symptom tracker. You can go to that and identify your symptoms, and it will give you an indication of whether you're at risk and need to be tested, and then you can contact your healthcare provider, and they'll walk you through the steps of getting tested.
Okay, great. Thank you.
Thank you.
I'll keep going with some of our other.
No, terrific.
I'll fill in the time. Our Council on Aging in the town of Adams has received a grant from the Berkshire Taconic Community Foundation, the Berkshire United Way, Northern Berkshire United Way, and the Williamstown Community Chest. They're going to put together Stay Active baskets
Oh, nice.
for homebound older adults that will include a variety of items aimed at helping people both physically and mentally active while they're at home. Our Council on Aging, Erica and her staff, they continue to do wellness checks, and people can call the Council on Aging at 743-8333 for any needs. And this is also probably a good time to remind everybody that the census, unfortunately, is still going on.
Yeah.
I really wish the federal government would pause that process because this is vitally important to the economic health of our region, but it is still going on. If you need assistance in order to complete Census 2020, please call the Council on Aging, call Town Hall, call North Adams City Hall.
Absolutely.
We're here to help you. We will get you through the process. It's very simple. We understand it can be intimidating, but that's why we're here. We'll help you do that. So just a few quick reminders about that as well. Private sector too. Private sector, we are responsible for managing communities. We're responsible for public health, public safety, and managing our budgets fiscally. But we can't help but understand that the private sector is impacted by this greatly. One Berkshire, oneberkshire.com has some great resources. We encourage folks to go there, start there, and get some information on what programs are available to help your small business. The Town of Adams, we just put a link up on our webpage with all those programs listed with those links. So folks can start there and start to do research on their own to help themselves.
Yeah. I mentioned the daily update that comes through North Adams. We put a landing page with that just because it was getting very long, and we offloaded a number of things. You can find that on link in every one of the newsletters, and it has again those links to One Berkshire and Mass Hire and the Department of Unemployment Assistance, some of the things that we talked about. I liked what you said about this Council on Aging and the wellness checks. That's something that we're doing here as well. And one thing that I heard anecdotally that I thought was very interesting was the Council on Aging was doing some calls, wellness checks for seniors, and there were some people who were very surprised to find that they qualified as seniors when somebody called in to check in on them. But again, I think that's really important to just to know that people are looking out and they're caring and being as responsive as possible. So we're starting to wind down, so I think we'll go to closing thoughts. And do you want to take the first one?
Sure. This one comes from our neighboring governor, Andrew Cuomo. We control our destiny like never before. What we do today will determine what happens tomorrow. And I think that's important. Everybody wants to get back to normal, whatever normal may look like in the future. But if we're not careful today, tomorrow may look worse than what it may possibly look like.
Absolutely, and I think we're so fortunate to live where we do, and I'm glad that thanks to our legislative delegation and Senator Markey, Charter Spectrum came to the table and gave us back access to news and information from Massachusetts and Channel 22. But I also appreciate hearing right now Governor Cuomo, because he's been an incredibly strong voice, as has our own governor, Governor Baker, and to be able to hear both of them speaking strongly, speaking sensibly, and sending a clear, concise message. And so my closing thought, and I think our last word for today, I'll give to Governor Charlie Baker, and it's from his remarks today, very simply: stay strong, continue to socially distance, and stay home. So thank you to everyone in the North Berkshires. Jay, thank you.
Thank you, man.
And stay strong, stay safe, stay home. Take care.